I represent for the ones of the doctor who working in the government hospital, far from the capital city, and with the crowded of the patients and with the limitation of the resource. What can I do to do something for the patient safety? I represent for that, not represent for the whole country. Okay. My name is Chutima Cheranakhorn. On my base, mine is the ICU doctor. I'm working in the ICU in the internal medicine department at the Hatyai hospital. Hatyai hospital is the major tertiary hospital in the southern part of the Thailand, yes. And in the medicine department, in our medicine department, we have the new patients, nearly 2,000 per month, 2,000 only in the medicine department. And 4 years ago, the journey is beginning after the 4 years ago. If your hospital have some patients who have the sudden cardiac arrest outside of the ICU, we have the high incidence of these cases. And we know that it's unfortunately about more than 90% will die or pass away in 1 year. Yes, this is a burden for me for the 4 years ago. And what I do, yes, for the 4 years, is have the 2P Safety Tech Hackathon Camp, yes, which organized by the Healthcare Accreditation Institute, joined with the National Science and Technology Development Agency. They teach us about the innovation. So today we have encouraged you here with the resource limit, it's not the all limitation for us, yes. The innovation will be the key to unlocking for the better patient safety, yes. And what we do, this is our application. We do the rapid response alert application with the 3 main objects. The first is one, we want this application to be the triage the patient who are in risk, classify the risk for the patient. The second is for the trigger, when it have the high alert, high risk patient. And the last one is for the tracer, to continue as monitor until patient is safety. Yes. And these are a few slides that will show how it's working. This application also can scan and identify the patient and the user by the wristband of the patient. And the second, you can choose the early warning score. We set the score that we identify the risk of the patient. And the third one, you input the vital sign parameter. Input the vital sign parameter to the score. And the application will automatically analyze, calculate, and classify the patient in the risk group, like the green or intermediate in the yellow, or the high risk group and the red one. And at the same time, you put food safe. This one will alert, if in the red group, will alert to the rapid response team and the owner doctor. At the same time that the score have to reach to the high risk group. Yes, and the rapid response team go out to see the patient. Yes. And the other one, we can do the overall, that's in the ward. How many people in risk, how many people in the safety? Yes, we can see the overall in the monitor dashboard. And this is the outcome. We do it for the 4 years ago. Start at the 4 years, this lean process and more effective. Early detection, early management, and the real-time activate to the rapid response team. And nowadays, about 2 million times that we use. We serve for the patient about the 90,000. And it is not the only number, this is the safety. This is the way to safety, more faster, more safety that we provide to the patient. Yes, and nowadays, the decreased incidence of the unplanned CPR in our hospital. And the next, we will expand it to the other hospital to use it. Yes, if you want to use, you can use it. Yes. And not stop that. We are continuous moving, just because we have the next challenge is when you can find out the high risk patient, but you cannot find the ICU. Is this your problem? You got the unplanned CPR, we can clarify some risk patient, but high-risk patient cannot go inside the ICU with many reasons, many barriers that we call is the wall. This is the application that's the ICU with our wall. We want to destroy any wall that barrier patient cannot go inside to the ICU. And this is a live OA application. This is easily to use. It can make the base reservation easily, like only you can order to the food delivery. Yes, like that. Very easy. Yes, and they have the predictive models that to predict the ICU benefits for any order, any reservation. And we have the ICU patient prognosis score to calculate, and the real-time information sharing to the ICU staff. This is the 2 years as I'm going to use this. About 3,000 patients made the bed reservation. You can see that we have the ICU-based occupancy is nearly to 100%, and the turnaround rate is increasing and decrease the length of stay in the ICU, and also decrease the death rate. Push more survive, because if you come in, can you go to the ICU faster, you is less organ failure. Yes. And it's not stopped. And we now today, we are still moving with the integrate of the high critical lab to our early warning score and the hemoculture alert to the warning score. That is our video, yes, the rapid response system ICU with our wall. That is the keywords of me is the innovation can be the better life and patient safety. Thank you.